Hello, friends, and welcome back to another episode of the Concussion Nerds podcast. And today we have a special guest. We are going to be joined by my dear friend, Dr. Brandon Brown. Now, technically, I always love to drop in technically. Technically, Brandon is an upper cervical chiropractor. But you know that I love to surround myself with exceptional humans who go above and beyond what their title technically says they do. And in today's episode, Brandon's going to share a bit of his journey. So we're going to have him back to actually talk about the neck and the nervous system and the vagus nerve, because we could like powwow on that forever as well. But there's something really powerful. First of all, Brandon, welcome to the episode.
Thank you very much for having me. I know it's been a while since we've been able to connect. So I was excited when I was like, hey, I know I asked to be on your podcast months ago, but now once we get into the story, obviously I can explain what happened and now where we're at. But now being fortunate enough to be here and be able to, have some fun and share the story of kind of what I went through.
Mm-hmm. I think sometimes, we always say that we don't necessarily need to experience what our clients experience to have empathy. Mm-hmm. But for those of us that have gone through a similar, not necessarily, obviously no one can go through the exact same journey, but when we are able to experience even a component of a piece of what someone might go through, our empathy gets that much deeper. And I feel like that drives our passion that much more. I know for me, I can always say I've never had a concussion, but the trauma element and the life element is kind of where a lot of my empathy comes from and a lot of the other layers that I do in treatment. And like we said, we were supposed to do this episode months ago. And then you kind of fell off the face of the earth on me. And then I was on your Instagram one day and I was blown away by what I saw. So I would truly love for you to share in whatever detail you want the experience you went through, but then I also really want you to share how that's changing your practice going forward.
Yeah, so feel free throughout this because
I'll
I'm
jump in. Don't
still,
worry.
it's for my own personal podcast. It's still an episode that I want to put together. It's content that I want to be able to put together just because it's not a story that I think a lot of people are going to be able, there's parts where they'll be able to understand, but it's like, I don't think a lot of people have gone through it the way that I did. So back in, well, we'll rewind way back. I've had a history of really bad ear infections most of my life. So off and on when I was a kid, better-ish when I was a teenager, and then I've had like little mini episodes. Like I can remember getting one at like 19, and then maybe like a one-off here or there of like maybe I get some sort of throat thing and it affects my ears, and then that's bad for a little bit, but then we get better and I'm fine. Well, last year around August, I got a really bad ear infection that was bothering me, but the way that I tend to function is just like, all right, I'm going to support my body. I'm going to take it easy. Like, I'm just going to check in and like figure out what it is that I need to do. I'm not going to run to doing something immediately. I'm like, typically if I'll rest and give my body time, it will get better. And this time, unfortunately, that was not the case. It was not getting better. And, there were probably multiple lifestyle factors of stress in business and at home, and who knows, there were probably a lot of things, but it just was progressively getting worse. I was having really bad ear pain on this left side over here, and it was affecting my sleep. It was starting to get in the way. And then on September 1st at like 5 a.m, I basically come to on my bedroom floor, and I have two giant firefighters in my bedroom that are helping me walk through my front door. And there are lights flashing, and I'm come to find out I had a seizure. It's the first time I've ever had a seizure in my life.
Wow.
And I had a seizure in bed. Haven woke up to me having a seizure. She kicked me off the bed. She was like, I didn't know what to do. I threw water in your face. Like, she had no idea what to do. Fortunately, we have friends that live close to us, so she called them. One of my best friends is a medical doctor too, so he ended up coming to our house, actually rode with me in the ambulance to the hospital because I have two daughters. They didn't wake up during this whole incident. My wife needed to stay home with them.
Yeah.
So fortunately, he rode with me. But coming out of a seizure, like, I worked with patients who've had them. I don't really know. I've never experienced. But it was like a reboot, and I couldn't talk yet. No words were coming out, and Haven was like, you had this look on your face. I'm like, I thought I was being arrested. Legitimately thought, like, what's going on? What did I do? Like, all I remember is going to sleep, and now all of a sudden this is going, like, what the heck is going on? And so they're like, straight shot from my bedroom to my front door. And so they're like walking me and holding me, and I'm like, what in the world is going on? So I get in the ambulance, she's talking to me. She's like, do you know what year it is? And I'm like, 2022? Like, I'm just sort of guessing at things. I'm just starting to talk. And she's like, close.
You're a whole
So
year off.
I'm still like in and out of sleep a little bit. So I know they took me to the hospital. They did CT, MRI. That all came back clear. They wanted to do a spinal tap, but I didn't feel like I had any symptoms for meningitis, which is typically what that's for. And so
Okay.
I didn't want to get it. So I told them I didn't want that because I hadn't really been eating or drinking a lot. I was really dehydrated. They gave me an IV and I like sucked that thing down and I was like, hey, can I get one more before I leave? So got an IV, went home, kind of laid and rested on the couch, but like was not doing well. So had a seizure, got released from the hospital.
So there was no follow up after that? No, like, let's connect you. Like, you had a seizure. You don't just have a seizure. There was
hmm
no follow up of, like, let's refer you to a neurologist. Let's, like, follow up with your GP. Like, there was nothing?
Not that I remember. My wife might know better than me, but from what I
Okay.
remember, we didn't have anything set up from that because all
Okay.
my testing came back clear and I'd never had one before. I basically got sent home, and probably because I refused some of their testing because I didn't want to get it. I've had patients get spinal taps, talk about horrible migraines and headaches when they get it, and it's just like I'm not open to a procedure if I don't feel like there's a reason, and it's like that doesn't really make sense to me in this situation. I don't have any symptoms of meningitis, so that's
Do
typically
you
why you would do that.
do you feel like they explained why they wanted to do the spinal tap beyond meningitis, or was that what they were looking at too? So, like,
No,
the education piece of why they wanted to do this investigation.
I don't really think you get any of that when you go through a
Yeah.
lot of this stuff. Like, you don't get a lot of, like, I rarely even tell people that I'm any sort of kind of doctor or have any sort of level of education because it's just like, I just don't want it to be assumed. Or on the other side, it's
Yeah.
just, let's just see what they go into. But I went home, was not feeling great, slept that night. Next day, went to my IV place that's right by my clinic because I was like, maybe if I get another IV, like maybe that'll help. Went and got a high dose vitamin C IV, hoping that that would help me feel better. Still not doing great, laying on the couch most of the day. So my, ears still bothering me. And so my wife was like, all right, she took the girls to my in-laws and was like, I'm taking you back to the hospital, but I'm going to take you to the one downtown. Takes me to the one downtown, sitting in the lobby, bunch of people. They will not let me in or check me in unless I'm willing to do a spinal tap. So I have to get a lumbar puncture in order for me to get in. And I'm being stubborn at this point and refusing. Like, I don't want it. What's the point? And my wife's like,
Yeah.
if you will just get it, they will let us back. So they take us like from the lobby, and they take us into a room that's like a room with like three people. There's like three beds, people in there, and like curtain dividers basically. And so basically my wife finally convinced me, and excuse my language, but I remember like literally saying fuck it, like whatever, just do it. And so
Mhm.
I guess I was so dehydrated it took them forever to be able to actually get it. So like I was like curled over laying on the bed on my side. Haven was there with me and she was like, I'm kind of in and out of sleep with a lot of this stuff, and she was like, you were so dehydrated, but I'm assuming nothing came back with that. So when I wake up the next morning, I'm in the room that they've got me checked into. They've got me on an anti-seizure medication, which I know is recommended sometimes for a lot of different things. Migraine patients that I work with get recommended that. Dude, it had me jacked up. I was dizzy. I couldn't walk. So I just was basically staying in bed. I was like, I can't even get up to go to the bathroom because this, whatever you got me on, it's got me all jacked up. They're like asking me questions because they're still trying to figure out what the heck is going on. And of course, I'm like, I've had a really bad ear infection for like the last few weeks. That's just really not going away. And what am I told? That has nothing to do with how I'm feeling. There's no way that that could have anything to do with the seizure. So they're not really worried about it at all. So then I'm getting test after test. I had a scan of my heart done. I had a scan of my liver done. I'm having blood taken every morning at like 4 a.m. so they can wake me up so they could get that. Getting all this stuff. They finally figured out that there's bacteria in my system, so they put me on an IV. That was probably the best that I'd felt. Started to feel a little bit better.
But they didn't know where this bacteria was coming from, did they? They just knew they'd
Mm-mm.
found it, so they were going to treat it.
Yep.
Okay.
Got COVID while I was there. They were like, you were negative when you tested
Well,
when you came in, but now you have it while you're here. And I'm like, okay, so I obviously
awesome.
got that from you guys. Awesome. But I was asymptomatic. I never really had any symptoms from that. Fortunately, I
Well, and in
had.
truth, like, you were so symptomatic from everything else.
hmm
Like,
Yep.
right.
Unfortunately, I had Dr. Sarah who was here holding the fort down. Haven's like texting her, like, hey, I'm taking him to the hospital. He's going to be here. So I think I was in there for like 3 or 4 days before they would let me
Wow.
out, which sucked. When they finally did, just the amount of antibiotics and, Keppra and stuff that they had me on, just feeling awful. Like I had lost a lot of weight again at that point because just not really eating or taking in a lot, not really feeling great, super tired, still lethargic. But they put me on antibiotics, wanted me to stay on those for the next few days. And then, like, that was basically the thing, get released. So slowly starting to feel a little bit better. Took my antibiotics like they wanted, go through the process. And then just the next like 2.5 months are just up and down of like symptoms starting to feel better. So I'm feeling better. So I'm getting back in the gym. I'm doing the stuff that I'm doing. I'm in here in the clinic,
Yeah.
trying to do stuff, but I'm more tired than I typically would be. Then I'm struggling to go work out like I typically would, even like a couple days a week, like one day a week, and I'm like wrecked and I'm feeling tired. And I'm starting to get a lot of the symptoms that I help a lot of my patients with. I got really bad headaches. I got really bad migraines. I got really bad TMJ problems. My jaw got so bad I could barely even open my jaw to eat. It got so tight on this side where the problem was. And then I was also not even feeling that hungry very often. So it's just like I'm starting to have this whole ramp up and pile up of all these symptoms.
So, question for you, because like you knew things were getting worse,
Hmm.
right? And I can't help but think like you're a smart man.
Hmm.
And like I feel like you had to instinctively know something wasn't right. Like what you were getting for your treatment was clearly not addressing. You and I talk about needing to find that root all the time, right? Like was clearly not addressing whatever this root was that drove the seizure and these other pieces. We talked about this earlier. It makes me think about like as the patient, like how many times intuitively do our patients also know like they're telling me it's not related. You got that
Hmm.
sentence. They're
Yep.
telling me there's nothing I can do. They're telling me they've treated me. I've been discharged. What do I do?
Hmm.
Like I can't help but think like that must have put you in a different position of like compassion, empathy, and understanding than really I'm guessing experienced at this point. Yeah.
Yeah, because I basically said the words, my wife and I debriefing once everything happened later was just like, why did we wait so long when I get into like what happened? And
Yeah.
I basically told myself, like, I guess I have to live like this. I guess maybe something has happened. I can't figure out what's going on. They don't seem to be able to figure out what's going on. And I've gone to the places that you're supposed to go to get all the tests done, and nothing's coming back with anything. So maybe I just did something. Maybe something's off. Maybe like I've legitimately caused damage to something that is causing the problem where I now can't overcome this how I typically would, which was not a fun place to be in and not a place I really
Mhm.
let any of my patients ever be in of like, well, I just feel like I have to live like this. And I'm like, you definitely don't have to
You
live like
definitely
this.
don't.
We help people just like you all the time. I'm so glad,
Yeah.
the things that I would say in that situation was like, for me, it was like, I can't figure out what in the hell is going on. And it was super frustrating. And I mean, I have like one of those like rice bags that you like heat up that you can like put in the microwave and heat up. Because I'm having so much pain over here, I'm literally having to heat that up to lay on it in order to get any sleep. Like I'm not getting good sleep. I'm not eating super well. I can't be active. I'm super irritable. Like my mental, emotional state, like all these things are
Mhm.
obviously massively off. My poor wife and also poor Sarah at the time of just like having to put up with me and saying, Sarah said I was basically PMSing for like 3 months, which is probably about what that felt like. But I can just remember like for me, I'm a very plugged in parent. I'm a very plugged in dad. I'm a very plugged in
Mhm.
husband. I am someone who likes to be doing stuff. So in that, I can be doing things that are helping, like, you know, let me help do those dishes. Let me help cook here. Let me take care of the girls here. Let me go change this diaper. Let me do that. Like doing all those things in order to help out because we're a team. I don't just expect her, like,
Mhm.
you do this and I do that. Like, we don't live that way in our household. Everyone does everything and we're all willing to help out. And during this time, I wasn't able to do any of that. Like, I would
Okay.
literally get home from being able to do what I could to see patients and kind of hold it together. But it's like, I can only imagine they've been super sweet and really patient with me, but I can only imagine what they were getting from me in that scenario. And hopefully, it's better than what they were before, but it was really hard to sit there and go through that and then just literally go home and lay on the couch. And, my wife obviously sit there and worry, is she going to wake up to me having another seizure? Is she going to wake
Right.
up to something going on? What in
Yeah.
the world is going to happen? And so she really pushed of like, we've got to go do something. So we
That's
went
who
to
my
an
next
urgent
question was
care.
like.
Yeah, so we went to an urgent care and I'm like doing some research and I know migraine can also be sinus related. You can have a lot of issues going on through sinus that will cause almost like a unilateral type migraine, which is what I was having. Some pain on this side, visual issues on this side, a lot of tension, pain, and everything going on my left side. So I was like,
Mhm.
maybe it's a sinus thing that's going on. So we went in, I had her check that out. She's like, I don't know if it's that. And then she looked at my ear and she's like, oh, but you do have an ear infection that's going on, which, duh, we already knew that. And she's
We've
like,
known that, but let's like this is an ear infection that's now been going on for like 4 months.
yeah, like 2.5 to almost 3 months now at this
Yeah.
point, basically. And
Like
I've been on
that's ridiculous.
antibiotics,
And you've been
which
on antibiotics and
may,
it's still
yeah,
there.
yep.
Like,
And
yeah.
so, she put me on a antibiotic and a steroid.
Okay.
But the fun thing was, is come to find out later, once I had had my surgery, was the bacteria that was in my brain, which is, we'll just
Okay,
get
so
to the fun
pause.
part first.
Take us
Yeah.
back to like, because people are like, I'm sorry, what? Come back to this fun point.
Yes.
What did they find? Was it on this visit or a different visit?
No, no, no. So it wasn't on this visit. On this visit, she put me on that stuff.
Yeah.
I started taking it about 2 days after. I get like this, like my head on this side kind of puffs out a little bit. And it's like I get this like little bit of swelling on this side. I'm like, that's weird. Like I have a picture. I can send you like my scans and pictures and stuff if when this gets posted and shared. It's like if people want to see, it's like you can see this stuff. So I took a picture because this side of my head was like just a little bit more swollen than usual. And then a couple days after that, my ear just starts draining. I'm talking like literally laying on my pillow and would wake up and like need a new pillowcase. I have this like yellowy, dark reddish stuff coming out of my ear.
That's not normal.
No, but I'm sitting there going, well, maybe something's going on. Like maybe that's a good thing. Maybe because nobody else has been able to figure anything
Right. And now
else out.
something,
And it's
you
like
took
maybe it's
something and
draining.
something's
Yep.
happening. And yeah.
So maybe it's doing something. So I'm literally having all this, and I'm talking for days, like
Oh my
several,
gosh.
several days. And like we had a meeting with someone from our church, a couple that we wanted to go meet with, and I'm literally sitting there with a Kleenex in my ear, just so that it's not like literally running out. Because it would have
Yeah.
moments where it's fine, and there would have moments where it's like it's just running out. And it's like,
Yeah.
okay. So we've got all that stuff going on amongst this because I didn't even really get into the fun symptoms with you that you'll really nerd out about. So along with this, I also start having weird random stints where I'll lose my central visual field in my right eye. So I'll literally run my hand across and
And it's
about
gone.
here, I'll lose it. And I can feel my hand and know that it's there, but I just lose it. So it's like my outer central visual field a little bit I'm losing, which obviously left side being affected,
Hmm.
that can now you can see makes sense. And I'm getting right lower leg weakness, like literally my legs giving out on me and like walking into the office and my leg literally just like
But none of these
dropping me
things would ever be related.
right. No, it could never ever be related to what the problem is or what's going on, obviously. Yeah, we would never want to worry about that. So it's like, I mean, legitimately, like one time walking into the office and I just like ended up on the floor and was like needed
Because
to
your
take a
leg just gave
second.
out.
Yeah, my right leg just like, and I
Oh
was
my
like,
goodness.
sort of I'm like, what in the world is going on here? And I had a patient that had traveled in town to see me that day. So I was like, okay, go sit down in the office. We're breathing, we're calming down. Okay, I think I'm okay. I'm going to be able to do this, like pull myself together, see my patient, tell Haven that that happened. And she's like, freaking out, obviously. Oh my
Yeah.
gosh, what in the hell is going on? She's got a lot of anxiety and stress and stuff that we'll get to work on for a little bit to just get past of, just all the things that happen. So as I'm having that, it'll be off and on. And you know me, I've searched it on my phone of what does this mean? You can
Hmm.
have some unilateral lower leg weakness because of steroid, like if you're taking like an oral steroid medication. So I'm like, maybe it's related to that. Maybe I'm having these problems. It was not due to that. It was due to this other stuff. So I always remember it was the craziest series of probably like 4 or 5 days. So I had a emergency brain surgery on Halloween, so October 31st of last year. The Friday before that, my child decides to shove rocks in her ears at school, and one of them falls out and the other one stays in. So we had to take her to urgent care so they could get it out because we could not get it out. They finally get this thing out, and I mean, it was large. And one of her teachers, I guess, told her that she didn't have any pockets and she wanted to keep it for later. So she put it in her ear, and one fell
Oh,
out because it was too small, and the other one stayed in there. I'm like,
oh, her
oh
little,
my gosh.
bless her, like creative thinking heart.
Yes.
Oh
So we
my
have
goodness.
we have that. Then Saturday, I come in that morning, see patients, come home, rest most of the day. Sunday, didn't go to church, make food, watch the Dallas Cowboys game. And then Monday is kind of when everything kicked off. So Monday, but like kicked off even more than it was. So Monday, I woke up, ran to the bathroom, trying to throw up, nothing coming out, which I'm thinking maybe I have food poisoning. Like my body's literally retching, trying to get stuff
Yeah.
out, nothing coming out. And I'm doing that like a couple times an hour till like 3 or 4 o'clock that day. So just like over and
Hmm.
over and over trying to do this. Can't figure out what's going on. I'm like, in my head, I just go, man, I must really be run down. Like my body's just really run down. I need to rest. Maybe I've got food poisoning now. I need to rest. So I think at like 3 or 4 o'clock, I fell asleep. My wife said that she had her parents come over. They tried to talk to me. I told them, leave me alone, let me sleep. Like, I don't remember any of this. So they basically leave, and I'm thinking, man, finally fall asleep, rest, wake up the next morning around 5 o'clock. Same thing, but worse this time. Still trying to throw up. I'm breaking out in sweats this time. I'm having the lower leg stuff going on. It's like multiple things. I'm tired and lethargic. And so it was on a Tuesday. So Tuesday is the day that both my daughters go to school. So Haven got up, took Remy to school, came home, got Elle ready, took her to school, came back, and I was like, something's wrong. You gotta take me to the hospital. She's like, well, where do I take you? And there's one that's like right by our office, but I don't know if it's Great Hospital or not. But she's like, I'm gonna take you back to Baylor. That's where I took you before. That's where they did my CT and my MRI. And she's like, at least they have records on you. I'm gonna take you there. So
Okay.
she calls my in-laws. They go to meet us there. They beat us there, even though they're further away, because it takes me so long to get ready. I'm like, Haven's like handing me stuff, and I'm like, take it forever to get ready. Finally get in the car. She's driving me over. My like 60-plus-year-old mother-in-law has to come out, and she's holding my arm to help me walk in. She hands me like a bag thing so that I can like dry
Dry
heave into
heave
it and
into
like
it.
get and throw up water into it. And I told her, I was like, if they have to have me go back, you're gonna have to have me get a wheelchair. Like, I can't. I'm so tired. I can't walk. And she's like, okay. So they wheelchair me back. And I know the lady's looking at me. For those of you listening, I'm like 6'4" and like 240, 250 pounds. And so I know they were like, how the hell are we going to get this guy on the bed? And she goes, can you get on the bed? This is literally one of the last things I did, get up, lay on the bed. And I just remember like, I'm here. They're going to figure this thing out. And I was kind of in and out of sleep. Haven kind of fills me in on some of the stories. So they tried to ask me again questions to just see where I was at. And Haven said I got frustrated with them because they wouldn't help me. They wouldn't give me any of the answers so that I could answer them. So I'm like, she's like, do you know what year it is? And I'm like, come on, guys, help me out. And they're like, we're not allowed to help you answer the questions. You have to answer the questions. And so I remember them taking my temperature a lot and trying to figure out what was going on, ask questions. And I just remember like when I finally like went under and went to sleep, I just remember kind of like rolling side to side. And then I remember at some point I was really, really, really cold, like freezing. And I was like, why is it so freezing in this room? But I couldn't wake up. Well, come to find out, that was when I went
That
back
was when you're on the
into my
table.
surgery. Yes. So what they did was, we talked about this, my heart rate started to drop so low, they took me back for a CT. When they did that, they found a mass that was about the size of a small potato of bacteria. So it's not considered a tumor, but it was inside of my brain. So by just pure being in the right place at the right time, there's like two doctors in my area in Dallas that are like the guys you would want to go see. Well, one of them, Dr. Denning, was at that hospital doing a surgery when I was in there, finished up that surgery, and literally rolled straight
Rolled it
into
into
my,
you.
like, went over, cleaned up, and like went right into my room. So it was like right place, right time with the right doctor. The stat that really flipped us out when I had my 2 week follow up with him, and I asked him because I'm a nerd, and we can get into like,
Absolutely.
explain to me when you did this and the surgery, because you guys can probably
I
see
can
if
still
you're
see it.
watching
Yeah.
this on video. Yep, I still got a pretty gnarly question mark scars. There's what I call it. But in asking
Young
him
kids
about
cut
it,
their hair to look like that, by the way.
I know, right? It's like, hey, apparently it's cool now. So no, I asked him, I'm like, his nurse practitioner was the first one to come see me. And she was like, man, we were really excited to see you. We want to see how you're doing. And I'm like, I've been doing great. Like, I feel normal. Been trying to take it easy. But for me, taking it easy is probably more than most people. But I'm legitimately trying to. And I asked the nurse practitioner that's worked with him for like 10 years. I'm like, have you ever seen anything like this before? And she goes, no, never. I've worked with him for 10 years, never seen it. So when he comes back, I ask him, have you ever seen anything like this before? And he said, one other time. They like meta-flighted a guy from like an area in Dallas over to him that was having like a nasal procedure done that he thinks they had gone in previously before, caused a problem. The bacteria got into that guy's brain. That guy didn't make it. So for us, because my in-laws are like, "Oh my gosh, you're a blessing." My pastor from my church came up. I didn't know, but he
Yeah.
came up and prayed over me before I went back for surgery. Like, lots of things, but I had sort of treated it really light. Of like, yes, I know it's serious, but like, I don't have some cool story where I'm like, I went to heaven. Jesus looks like this, blah blah blah, and I can tell you all these things, and this is what it felt like. Like, I just took a really, really, really long nap, and then woke up and had a surgery and had this big pad on my head and was like kind of being told what happened, but I had no
Hmm.
jaw pain and my ear was working and like everything felt great. And I'm like,
Everything
I
felt
have
good.
no idea. Yeah, I have no idea what's going on. So of course I got all the details of like the
Yeah.
surgery and what they did. So whenever he went in, so basically they cut this like big round and like just over my ear here, and they like lay the skin over. So they do skin first,
So crazy.
then they cut through the muscle. So they basically just cut this muscle and lay it down. When he did that, he found a hole in my skull that the bacteria had eaten. So it had eaten away at the bone,
Holy shit.
as you can imagine. Yeah, crazy. So then they're literally cut through the bone, take that piece off. There's a hole in the dura that sits around my brain,
Oh my God.
literally, that was how it had gotten in there. So based on the CT scan, because they found it, they knew where it was. This is the part that like is cool to me and trips me out. And for anyone that's like, hey, prayer doesn't work, it's like I truly and fully believe that it does after this situation. So they're going in and looking through the folds of my brain to try to find this. My body literally pushed it out. It just like he was like it. You're looking and it just kind of, and he was like it just popped out. So like they still had some pieces to like go in and clean out, but he said as soon as the piece came out, he said my whole brain relaxed and just shrunk. So my brain had swollen to try to hold it there and to try to keep it there to protect me.
To
Because if
protect
it had
you.
gone any further or crossed over, like it could have caused a lot of other very, very serious problems. I was
Mhm.
so blessed in this situation. But he said they would have had to leave my head open. They would have probably
Yeah.
helmeted me or something because they have to let that pressure come down. Immediately, once it came out, just my brain just
Everything
relaxes
relaxed.
immediately. And I'm like, oh my gosh, that is so freaking awesome. The body is an amazing thing.
It
And so
really
he was
is.
like, did that, clean it up, put it back together. I don't know why I didn't think about this, but obviously there's like screws and stuff in here now to like hold the bone in place, put everything back, staple my head together. And then they kept me sedated the rest of the night. So my poor wife, she went home. Fortunately, my in-laws are with her. Like, she was like, I
Yeah.
hope you're not upset that I went home. I'm like, what were you going to sit around with? I was
I was
asleep. I was out
sedated.
of it. Well, the next day, the nurses tell her that they had a hard time keeping me sedated. So they're like, is he known to like take a lot of narcotic drugs or anything like that? She goes, no, he rarely ever takes anything. They were like, we were trying to give him everything that we could, and he would not stay sedated. So they could not keep me under. And then they also eventually had to strap me down to the bed because I tried to take all my stuff out. So I was intubated and I had a catheter in. I almost got my catheter out, which is, that's a whole nother not, but I don't remember any of this because I always jokingly call this like subconscious me. So you have
Yeah.
to realize my wife didn't get to tell me I was getting ready to go back for surgery, nothing. Like I fell asleep and never woke up again until the
Yeah.
next day on Wednesday. So you got to realize I'm waking up and I have all these people around me that I don't know. The nurse goes, it took 5 of us to hold you down so that you wouldn't pull stuff out and do. And she was like, I figured out that if we would stay super, super quiet, you would stay asleep. So she was like, I was basically watching over you and people come in and I'd be like, shh, like do what you need to do, but stay quiet. And then the most fun one is the next day. So my wife and my father-in-law are there and they're starting to let me come back awake, but they don't take your intubation tube out, which is to help you breathe. They want you to breathe on your own for about an hour. Well, I'm very claustrophobic and I started to get irritable and anxious with it in there. So I'm sort of waking up and then going back asleep.
Mm.
And I'm trying to get my wife to take it out. So I'm thinking in my head like, ooh, if I sign water, like she'll give me water, she'll take it out. And she's like, I can't take it out. The nurses want you to keep it in. So I'm trying to get her like, you got to get this out. She's hitting the call button. The nurses are like, man, we're not going to take it out yet. I'm trying to bite down and push it out. I'm trying to like do anything that I can. And I start like shaking the bed because it was making me like I couldn't
Yeah.
breathe. I don't know if I had moved it or what, but I couldn't breathe very well. And I was starting to get like, I was freaking out. I'm like, I cannot breathe. I'm getting anxious here. And the last time that she called them, she was like, y'all have to take this out. And they're like, man, we can't. And they're like, if you do not take it out, he will pull it out. And literally they're like, ma'am, you need to wait. And I wiggled this arm loose and reached up and I freaking yeeted that thing out of my throat.
You pulled your freaking it.
Yes. And as soon as I did, I went, and I took a deep breath in and I fell asleep. Is my memory, and Haven goes, you did not fall asleep. You literally screamed at the nurses, you're trying to kill me. So the next day when I
Oh
was
my
like more
goodness.
myself, I apologized to them and I was like, listen, I've got a clinic. If you ever need to come in,
Free treatment for all of
you could
you.
just, yep, you guys took amazing care of me. Oh my gosh, thank you so much. I'm so sorry. And she's like, it's okay. I know that that wasn't you. I'm like, oh my gosh, I'm so sorry. I apologize.
Holy cow.
But yeah, that was the just craziness of the whole story of, my wife's already not a big fan of Halloween anyway, and now probably not much more not going to be the case. But yeah, it was one of those that fortunately we caught it at the right place at the right time. I think, you know, the way that it went, I wouldn't really want on anyone, but because nobody else really had a chance to jack around with it or do anything, is probably for the best. So not the
Hmm.
way that I would want it to go, but it kept it from being an issue that, got worse because of
So
that.
thank you for sharing that. Like that, I can't even like wrap my head around everything you went through in that time period. I think like there was a lot that happened overall, big picture, condensed period of time.
hmm
Obviously, didn't feel condensed to the moment, like, but looking back, like this happened over a grand total of what, 3 months?
Basically, like 3.5 to 4 months.
Yeah. So it's like when you look back at that now and you look at that experience you had within the system and like trying to advocate for yourself, but not knowing what to do, like, how does that make you look at like the clients that you and I treat, for example, to be able to have words for them when they're trying to navigate this path? Like you work in the medical system, like you understand the brain and the body. So how does that make you look at clients today to be like, how can we empower them from this experience that you had for yourself?
Yeah, so for me, it's a lot of I always try to advocate for patients to, if they have a crappy doctor that they've just gone to forever, to fire them. It's okay. It's okay to move on and to go somewhere else and to not feel comfortable just accepting an answer that you're given and keep advocating for yourself to look for answers. And I get it. I know when I tell this story, it's like I'm an outlier. I have so many patients that have gotten scans, tests, all the things done. They didn't find anything. I got lucky that they found something and they found it at the right time and they got it out. But that doesn't mean that there's not somebody out there that can't help you, that can't advocate on your behalf and be able to help you and walk this journey and be able to take you down that path. So for me, it's like I understood the side of like being so symptomatic and it taking over and just like being a part of your everyday life and, changing your mood and who you are, just so many things when it comes to that. So it's like being able to engage and relate to that side, but it's more on the aspect of just like, I want to advocate for people to like, I feel like we do a lot of like, wait and wait and wait and wait and wait when it comes to things with our health. And a lot of times I think we would save ourselves so much time and money and energy and so many things if we would just get ahead of that. I
Mm-hmm.
know I'll just speak for men. Typically, we don't. It's, oh, she'll drag me or she'll make me do this or I'll do it. Like, I'll just, because I don't want to have to worry about it. I don't have time. And it's like, well, if I didn't do what I needed to do with that, I was going to get no more time. My time would be done. And you just have to look at it, I think, somewhat in that. And it's like, I know it's not a fun way to look at it, but it's like it totally for me has shifted perspective now where I'm like, I'm not perfect, but so many times now I don't sweat little shit because it doesn't matter. Like, so what? Every day for me now, because of everything I went through, is the biggest gift that I can ever imagine because it's like I'm still getting more time to help more people, to spend time with my family, my wife, my kids, to do the things that I love to do. And it's like that easily could have been taken away from me. I could have
Mm-hmm.
woken up different. I could have not woken up. There's a lot of things that could have happened in that situation. So yes, from my standpoint, it's like, oh, but it's like you've got to still be willing to always ask that other question, go to another place, try out another thing, because you never know. And you can't give up. Like, I sort of had done that. I'd given up. I just accepted that this was how. And it's like, you can't do that. You have to continue to fight and advocate for yourself and make it a priority because all those other things are literally not going to matter. And I know you hear that story from people that are in their later years and enjoying things. And it's just like, hey, don't worry about these things and make sure that you take this stuff very seriously. And it's like, I just wish I would have done that sooner. Maybe that could have done something that would have changed it. I don't know. The story was written how it was written, and that's
Mm-hmm.
what we went through. But it's like you just have to be willing to always take that action, advocate for yourself, ask questions, and make sure that there's also that like relation there where it's like, I get that. Like talking to Dr. Denny, who did my surgery, he knew that I had a wife and kids. He told me like I knew about your story. He was just like I could tell it weighed on him a lot when he was doing back and doing my surgery for him and the people working with him to have a doctor who does stuff like that, and typically you're like, you want someone that's really cocky and arrogant and all these things. Like he wanted to make sure that he was aware of my situation, what was going on, and like that was important and mattered to him. He didn't just disassociate from it so that he could do his job,
I
but he
love
actually
that.
cared about that a lot so that he could. I'm going to do everything that I can for this person. And it's like that for me is awesome because a lot of
Mm-hmm.
times medical doctors and people in the system, they can get shit on. And it's like, there are great doctors out there, but sometimes they
Yes.
can be hard to find them. Sometimes it's not the one that's local to you or close in your small town or something like that. It's like you still have to be willing to do whatever it is because it's your health, it's your body, it's the one thing that you get for your entire life, and you have to make sure that you take care of it because if you don't, sometimes you might not be able to get some of those things back. And that doesn't mean that you can't overcome stuff. It's like we've got to be smart about what we're doing because if you don't, it just becomes this spiral that I went down. And it's like, I don't wish that upon anyone.
Yeah. I love that. It's that whole piece of, when we think of, I know in your clinic, you have people that travel to work with you, my clinic, the same thing. And we're very rarely practitioner single digit, right? Like we're practitioner 10, 20, 30, 40. And I always tell clinicians too, like, check yourself because when someone says like your person number, I was person number 42. And it's like, A, that should never happen. But B, to that client, it was like freaking kudos for you for not giving up on yourself. Right. And
You
so
have to. And I know how frustrating it is because I know, especially in my system, when you've gone to neurologist after neurologist and you feel like they're all giving you the same answer. And I'm like, well, that's part of the problem is our system is created. It's not their fault. They chose to go down that route. They probably helped other patients with weird neurological stuff get better. But with migraines, they're not quite sure what to do. And they've been told, well, you never want to work with this person or do this. It's like they've had all this stuff put around them. So sometimes it's the shackles that they've been put in that they can't help themselves. So of course they didn't recommend that you would ever find us, but it's not from, you just always have to hold on to that little piece of hope that's like, maybe this is going to be the place.
Absolutely.
And you can go in and ask questions and do things, do all that stuff. It's like, always let that little piece of hope come in there because if I can work with you and help that to grow, then you're going to be like, holy shit, I think we can do something here. I think something can change. I think we can actually get this back and get my life back. And it's like, I always want people to know that that's a possibility. It's always an option. It's always on the table. We just got to find the right way to get it.
I'm going to wrap that right there. Thank you for sharing your story and your journey and this like other side of experiencing health and all your kind of lessons from it. We will absolutely have you back to share.
I would love to nerd out
talk
about what I do. Yes.
about what you do and we can pow on the vagus nerve forever too, we know. So, but thank you. Your story imparts hope in itself and just has a beautiful underlying message as well. So thank you for being here. If people want to reach out to you to know more before I get you back again, what is the best way to contact you?
Usually just through social media, like literally go to any of my stuff. It's at the migraine doc. You can message me on IG or you can go to thespecificrichardson.com, which is my website. You can submit a schedule request there, even if you're not local, just because you want to ask questions or connect with me. You could do any of that, but you can go to any of those places. But usually on social media, it's typically super easy to find me. So I'll make sure I get you that information. It can be put into this.
We'll drop it in the show notes for sure.
Yep. Perfect.
Amazing. Thank you so much, my friend. To everyone listening, thank you. And we will see you next week for another episode of the Concussion Nerds podcast. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.